Okay, good afternoon, and welcome to the presentation this afternoon. Prynawn da a chroeso i'r cyflwyniad prynawn 'ma. My name is Aled Jones from Cardiff University. Could I see the slides, please, Rich? Thank you. From the slide there, you can see my name is Aled Jones from Cardiff University. I'm Professor of Patient Safety and Healthcare Quality at Cardiff University, and I'm also the Health and Care Research Wales Specialty Lead for Health Services Research. And this afternoon's presentation is on, well, talking about the future direction of health services research in Wales, and this question of the possibility of starting a health services research network for and within Wales. Before we start, I'll just point out a couple of functions. As you can see, there's a chat window on the right-hand side, and you're obviously welcome to use that as you see fit to interact with me, ask any questions, queries. There's also ask a question function at the bottom of the screen, which you might be able to see, and you can use that to ask a question as well. You're all muted, so I can't hear anything. So the only way we're going to interact is through this through the panel on the side there. The presentation has been recorded as well, and the recording will be available from October the 7th onwards, when the conference goes live formally, as it were. So should you wish to watch it again, then please do that. And my contact details will be available at the end as well, should you wish to contact me after this. I'd be more than happy to receive any messages from there. In terms of asking a question, if anybody wants to ask a question, please use the function at the bottom. There's also a vote option with asking a question. You can vote up a question if one was seen to be particularly important, relevant, more so than any others. Then you can vote up a question as well for our attention. Next slide, please, Rich, please. Thanks. In terms of question and answers, it's obviously a less than interactive format in some ways, that this sort of internet presentation. But as you can see from this slide, the presentation I've broken up into 3 areas, and these have been designed as fairly kind of short, sharp bursts of information, and then I'll stop and watch the chat function, look at the chat function, look to see if there are any questions being asked at that point about the content that's being delivered. And at the end, there'll be a Q&A as well. The presentation is for an hour, although how long it actually takes depends on how much interaction we've got. I think what I've got to say will probably take no more than about 20 to 25 minutes or so. And yeah, we've got up until an hour from there onwards to discuss things further, should we need it. The presentation, as you can see, I'm going to give some background initially to health services research. The acronym we use is HSR, and present a definition that I use. I think it's a fairly commonly used definition of HSR, largely because there's a very diverse audience in the room. There are 100 people registered, which I'll come to in a minute. Once we've done the background and introduced what a specialty lead is within Health and Care Research Wales, I'll start kind of picking apart some elements of the question around why a Wales Health Services Research Network may be needed. Who do we consider to be researchers, for example, and why now? And that will bring us to the end of the presentation. Next slide, please, Reese. So who is in the room? Just to give you all, in this kind of disembodied way of doing online presentations, who is actually here. So there's about 50 or so people actually on the call at the moment, 46, I think, out of 100 that were registered. So the others may well choose to watch this at a later stage. It's not a bad response rate in terms of turn up. 50% is pretty good, or thereabouts, 46%. To be accurate. And the audience is typical of health services research in many ways. There's a variety of healthcare professionals, service users, third sector organizations, from a variety of different industries and sectors as well, including local government, sports, social care, national government, in terms of Wales, that is. A range of researchers at different stages of careers and experience, and those who indicated in the pre-seminar questionnaire where they were working, well, clearly those joining the call are working across the UK, Europe and North America on health services research. But there's also those who aren't and who are very new to this area, but clearly have an interest in learning more. Next slide, please. So like I said, just to make sure that we're all on the same sort of page definition-wise, the health services research as a discipline in itself is characterized by these main points. It's about research into underpinning improvements in the way health services are organized, planned and delivered, including health technologies and health policy. It's multidisciplinary, it's multi-professional, and it's applied. And it's characterized by these diverse sort of boundaries across which it works: public health, population health, health economics, health systems, and a whole battery of different methods and methodologies around that. And a number of key areas are consistent within health services research, including service provision and delivery, improving access, and assessment of health technologies in all their diverse forms. Changes to healthcare workforce is an area that I'm particularly interested in. There could be either policy or practice-driven changes, health financing, leadership, and governance. Next slide, please. This is an example of a study. I'm currently a part of a team. It just really characterizes exactly what I've just mentioned there. It's a mixed method study, primarily a prospective randomized controlled trial around changes to follow-up treatments for people with age-related macular degeneration. It has, like I said, a fully scaled up randomized controlled trial. It has a qualitative, mixed methods qualitative process evaluation looking at the changes for staff and patients within that service. It has a health economic evaluation. It's multidisciplinary, and it's multi-site, led by clinicians, supported by academics, and it's very much the model of health services research that is kind of alive and well. And it's a large version of what could be classed as health services research, but it's very kind of live version of those kind of cross-disciplinary nature of the work that we do. Next slide, please. So health services research in Wales and the specialty leads role, just give you a little bit more information about that. I'd be interested if anybody could type in whether they'd heard of the specialty leads role or whether they haven't, within, especially those working, or primarily those working in Wales, whether that's something that's in people's minds. If I said, okay, that's great. I can see some people who have heard and some who haven't. So that's really useful to know. For those who don't know, or even for those who do know about specialty leads, then the leads are appointed by Health and Care Research Wales for a 3-year tenureship. Currently is 2019 to 2022 is what we are currently in. And the specialty leads map against the 30 NIHR therapeutic area specialties. Could you just go quickly to the next slide, because thank you. These are the 30 therapeutic areas that NIHR sort of arrange and design their work around. The specialty leads in Wales, there's one for each of these. And as you can see, health services research is there in red. The great thing, the challenge, and the kind of the beauty of health services research is that they could exist in each of these individually as well. So there's a main body of health services research, but as I showed with the Fenetra study, it's the primary area that it's been identified through NIHR as number 22, an ophthalmology project, within which a secondary area of research that we've identified is health services research in there. So if we go back to the previous slide, if at all possible, thanks. As you see there are 33 studies currently on the Health and Care Research Wales portfolio that are identified as a managing specialty as health services research, but they don't actually count where studies may have also identified HSR as a supporting specialty. So there are more than 33. There are 33 that are primarily identified as HSR. The people in the role before myself were Paul Brocklehurst, Professor Paul Brocklehurst, and Chris Jones from Welsh Government. They undertook the role between 2016 and 2019, and I'll go back to some. I'll discuss some work that they've undertaken later. They've already done some scoping around HSR in Wales, which I'm going to pick up on. I was in post really beginning of 2020, and then something happened called COVID. So, okay, next slide, please. And the next one after that, thank you. That's great. So the specialty leads roles, so what are their key tasks and responsibilities? So these are a few more details. So there are 6 main tasks. The first one in red, because that's what we're going to discuss a bit more today. So one of the key tasks of a specialty lead is to establish and maintain a network of researchers within the relevant specialty area. I would say the next 5 tasks are really facilitated by a network. So to do numbers 2 to number 6 well and to do them properly, I think it's kind of predicated on there being a live and meaningful network of individuals, which we haven't actually got at the moment in Wales, a formal network. I think there's loads of informal networks, people I know, people I've worked with, etc., that I can plug into as somebody who's relatively experienced and been around for a while. I'm wondering, for some of you who are new in the field or emerging or developing a career in health services research, actually how easy it would be for people to plug in. So that would be one thing. Like I said, that I'd be keen to develop, which is a key task of the role. The other 5 are around helping studies get set up within Wales, working with Health and Care Research Wales, the portfolio studies to get them up and running, to get them into health boards within Wales, to hit their recruitment targets, to provide some reports to Health and Care Research Wales around that on a quarterly basis, and to work, like I said, with NHS R&D offices to support and promote healthcare, health services research in all aspects and throughout the research journey, from even kind of pre-setup all the way through to completion. Next slide, please. So at that point, I'll just quickly look through and invite any questions and see if there are any. I'm just scrolling through, so I can see people are responding to the question I asked about specialty leads, and most are saying no, I think. Quite a few yeses as well, which is good to see. Hopefully people will know a little bit more from that brief first few slides, and I'll go back to some of those key tasks around networking in a minute. Somebody, Misfit, was asking, would that include nurse leads and research? No, we wouldn't. This is a cross-disciplinary role, leadership role within the specialty of HSR. So we would be interacting with nurse leads and leads within R&D's offices of various denominations and professions, but the role would not be a specific nurse lead. I am a nurse by background, I'm a registered nurse, even to this day. So, but yeah, not specifically a nurse lead role in research. Okay, let's go back to the slides if that's okay. There's just a question coming from Angela, which is, if there was a HSR study in a primary care setting, would you also link with a PC specialty lead? Yes. There's an option to do that when a study comes in for kind of adoption and onto the portfolio. It's not always possible to track every single study in every other specialty lead. So that's something I think I would like to look into a little bit more around. Are we being alerted sufficiently to know of other studies that are going on in other specialty areas like primary care? I know the primary care specialty lead very well, and if there is one area, I'm not saying there particularly is, but if there's one area where health services research intersects with particularly, I would say that is primary care. So I'd be particularly keen to have a connection there if I didn't already have one, and I think I have, but I'll come to some of this later as well around not overlapping or duplicating things that are already in place, such as the Prime network in Wales. I certainly wouldn't want to overlap with any, well, I'd like to overlap with their work, but I wouldn't want to sort of confuse people around that. Before we move on, there's another question here. If one is undertaking unfunded research, that could be defined as HSR. How could this be linked in with other researchers and specialty leads? Okay. The issue there is unfunded research, and we would know little about that currently, formally at least, because of the portfolio status. So most of the studies we deal with, and that I know of through this role specifically, are portfolio studies. So they've been adopted because they're usually funded and competitively so, and there are criteria for what a portfolio study are. They're not exclusively always competitive, but they usually are. But what I'm trying to emphasize there is that that's the formal way of identifying and knowing about studies working in this field, and maybe through a network, then we can all start to build informal knowledge networks and intelligence about other types of health services research that are ongoing in Wales. They may be on that pathway to portfolio. They may not be on the portfolio yet, but they may well be prospectively looking ahead. It could be something that's being developed. So I would say at the moment, it would be difficult to, formally through this role, to see those studies, if you like, to have sight of them. But at the same time, what I'm hoping to do is generate a kind of informal network of communication and support as well, so that wouldn't necessarily exclude those types of unfunded or early stage research. And then yes, you could link in with other researchers and other specialty leads. You know, there are 30. There's a lot there going on, but they're not silos either. We should be interacting as much as possible, and we try and do that. And Healthcare Research Wales try and facilitate that type of activity of interaction as well. Before I move on, there's one final question, which is any similar HSR networks elsewhere in the UK? So it's a really good question. There are networks across the UK of various types, going back to maybe things like formal or informal networks. I'll come to some of them in a minute. I think the people I work with, primarily researchers that are in England, for example, health services researchers in England, I feel they benefit greatly from having ARCs. They used to be known as clerks. Their research centres funded by the NHS, about £135 million, I think, has been invested in those centres. There are also academic health science type networks that are in place, clinical research networks, etc. So there are networks, especially so formally in England, that I feel captures quite a lot of health services research activity. In Scotland, Northern Ireland and Wales, they tend to be more focused around universities rather than the NHS, but they do exist. But there's one UK-wide network, the HSR UK group, that clearly covers all the UK. And I'd advise anybody to have a look at their website and their information about the services and the excellent conferences and networking events they offer. And I'd be keen to work obviously further with those individuals, but then keeping this as a Wales specific network as well, that meets some of the needs within Wales that other UK networks might not be may not be first and foremost in their minds. Okay, so why a Wales HSR network? I think I've probably touched on some of that already, but if we can go on to the next slide, please, that would be great. Thank you. Going back to, so this is the kind of the job description part of the answer to that question. The question being why a network? Well, it's partly the job description of a specialty lead to have a network. And like I said, I think a network is really crucial to the other functions of a specialty lead role in terms of setting up studies, being aware of studies, and the subtasks have been identified by Health and Care Research Wales. So what are we doing, or what are we supposed to be doing? These are what Health and Care Research Wales publishes as the subtasks. And you can see there's language there on things like developing support events for principal investigators, a register of principal investigators in Wales, providing signposting, advice and mentoring, going back to, I think it was the earlier question around what sort of support would we, Alyssa's question. So yeah, it would be signposting, advice and mentoring for people who want to become PIs and otherwise engage in the research, and working to help increase the number of non-medical PIs across Wales where possible, where I think actually in health services research there probably more non-medical principal investigators than maybe in some of the other specialty areas. I've amended those subtasks a little bit just in light of that language. If you can go on to the next slide, please. In the red font, rather than focusing on principal investigators, it's a term that I find can get commonly misunderstood or can be a bit excluding. What is a PI? What exactly is a PI as opposed to a CI, a chief investigator, for example, can be confusing. So, and in the spirit of inclusivity around health services research, as I've already hinted on about, I would actually be more interested in a network of interested researchers. So I've just kind of changed some of the language there. And then point 1.5 at the bottom, I've just added another one, which again is maybe characteristic. I think it's in all of the specialty areas, all 30 have a need to be cross-sector more so. But I think in health services research, especially so, given the emergent sort of policy environment around social care and third sector involvement in healthcare in particular, local authorities, and the close interaction often between health services research and policymakers and governments. So I think, yes, absolutely peer support events for researchers therein, but also I think facilitating a broader level of involvement across the horizon that health services research exists within as well, and that includes social care. So maybe we should be calling it health services and care research or something like that. But the next slide, please. This is again just what I consider to be interested researchers, this broad definition, as I've already alluded to. It's not just about NHS and universities. I think it has to be multi-sectorial. It has to involve all students, all researchers at all stages of their career, from postgrad onwards. And differences in academic practice, we've already talked about, is very, very sort of diverse and plural sort of approach to disciplines and practices and managers, policymakers, clinicians, and also patient and public members as researchers or as advisors. I've worked with both, where we've trained patient and public members to be researchers on projects and collect and analyze data, as well as benefit greatly from having PPI input into project advisory groups and the like as well. And that would be guided by the UK standards for public involvement in research. So for me, HSR researchers are all of these things. It may be a little bit too broad. I might be asking for trouble by having such broad boundaries in some ways, but to me, it kind of sits more comfortably with kind of the broader philosophy of health services researchers. If we move away from just looking at sort of principal investigators and researchers within some of within the NHS and the universities, for example, and actually broaden that out, given that a lot of research exists elsewhere and will increasingly do so in the future, I imagine. Okay, next slide, please. So I'm wondering, before we move on to why now, the question of timing, if there are any questions about the specialty lead role or those tasks. I can see one here from Julia Hiscock in Bangor. How would you advise we go about being part of a network when our work fits into other specialties as well as HSR? Well, yes, good question. I think it's, there's obviously, I've already mentioned that there's the danger of duplication and overlap. That is a risk. It's also kind of an opportunity, if that doesn't sound too cheesy. That all risks are opportunities as well in some ways. But I think the risk there is overload of information. I imagine that if you're in many networks and research centers simultaneously, that you'll just get drowned out by information, and you'll lose interesting things in the mass of the noise that comes through email and what have you. So I think it's really kind of a filtering exercise and making sure that really what we provide, if we set up a network, really sort of cuts through the noise and is kind of timely and focused rather than making noise. And a lot of these are still questions in my mind, to be honest with you. This is very kind of early days, and I could easily listen to why people would say, why would we have a network given that all these other things exist? I think there is space for it, but I completely take your point, Julia, about how you would do that without actually being drowned out by, like I said, how does it fit into other specialties as well? But I think it's, as me particularly, joining up the work I do with other specialties and being clear that the health services research exists as a resource for those who want it. This isn't compulsory, obviously, by any means, and if people feel that would be a useful resource for them to be part of a network, then by all means they should. Question from Elizabeth is, what is distinctive about Wales HSR compared to the UK? That's a really good question. I think there isn't, I mean, there are commonalities, not just in the UK, but internationally. When you look at health services research, there are common areas of research, common activities, and common ways of thinking. And the distinctiveness in Wales is an interesting one, isn't it? In terms of the size of Wales, the fact that we are quite well connected already, but maybe we don't capitalize on that sufficiently to do the work that's needed. I think one of the things in Wales is that we do have really good access to policymakers and government compared to when I work on projects with colleagues from elsewhere, not just in the UK, again, internationally as well. They comment to me quite often how impressive they feel it is that we have the ear of policymakers and the NHS as well, that we can get things moving quite quickly in Wales when the will is there. So maybe the distinctiveness is in terms of size and connectivity in Wales, but that doesn't mean to say it works well every single time either. Okay. There's a question there from Martin about HSR in Wales more distinct than the other 29 specialties as policies. I'm not quite following. Maybe Martin could just clarify, and I'll get back to that later. I'm not quite following what the question is there, I'm afraid. Up next is why now. Could we go to the next slide, please? I think that the why now I've already covered in terms of there's a perceived need for this as part of the specialty lead role, as a researcher working in Wales. Even though, like I said, I feel like I'm pretty well connected, I still feel there's a there's a need there that goes beyond that, especially for early careers researchers, possibly who may not have established networks and are looking to do that. Clearly, HSR is an international phenomenon. It's looking just within Wales, and kind of navel-gazing in Wales won't get us too far. I mean, it'll get us somewhere, but we need to be aware of the international dimensions of health services research and how quickly that is moving. We're clearly living in unprecedented times, although I often feel like people throughout history have probably been saying that. And there is only one constant, and that is change. But having said that, there are key changes on the horizon within health services research across the globe. There are two I've mentioned there kind of briefly in terms of the USA and work ongoing within the European Union that are clearly addressing and asking questions about the future of health services research. What will they mean for the forthcoming decades? What sort of research should we be doing? What should we be prioritizing? What's sustainable within research? What sort of funding models should we be using for healthcare services research? As health services research, what sort of pressure should we be applying to different parts of the decision-making format around funding, around support for research? My view around this is that, again, without a consistent identity of health services researchers in Wales, that I don't feel like we can probably contribute to some of these debates to reach, at the moment at least. Somebody's mentioned Brexit there. Healthcare Research Wales are part of the To Reach project, which is a Horizon 7 funded. I think it was Horizon 7 at least, and is coming to an end fairly soon. But yeah, I think there are those needs within Wales, and then there is a big need outside of Wales. And there's this talk of a new era for health services research that I feel like without a network, we may start falling behind the curve around what's available there, and what may be available to change within Wales, and future-proof some of the stuff that we do. So there's that. There's a question there from Alyssa around Brexit and its effect in Wales. Well, who knows at the moment? I mean, there's various guarantees around ongoing research funding that has already been allocated, and there are various noises being made about continuation of funding and availability of funding for UK-based researchers. But it's clearly going to be a time of change, and we need to keep an eye on that. And it'll affect HSR in Wales as much as anywhere else, and across the UK. So it's important in a way. One of the functions of the specialty lead role is to participate and contribute to the NIHR. There's a specialty group for health services research, which I attend as a specialty lead, and clearly being there and listening out for what's happening across England and within those areas is really important. Can I move on to the next slide, please? And then I'll come back to some of those questions. So what is the purpose of a health services research network in Wales? Again, these are just my own ideas, and what I'd really like is for us to carry on this conversation, hopefully in a more kind of interactional format in the future. But these are already talked about: a space for HSR research and researchers in Wales, remembering that this is a broad definition of researchers. It's not just about people in the NHS and in the universities. To carry on with facilitating kind of a responsive environment for hosting HSR projects in Wales from anywhere. Our main customer, if you like, at the moment is England. Projects that are devised and led by English researchers where they have a site in Wales. It would be good to diversify that a bit if at all possible. But it is there. I mean, I'm not suggesting that we're not welcoming and we're not responsive, but there's always more that we can do. And we having a network would help with that, would help me specifically, but others as well, to identify opportunities for collaboration, for hosting research, for bringing really high quality research into Wales and out of Wales, and importing that as well. Sorry, exporting it. And obviously the reason why we all do this is to improve health and social care in Wales and beyond. And I think at the moment, again, we all probably have our own existing networks and silos that we work in, cross silo working, cross academic group working, cross sector working will only ever improve the impact of our research. Closer working across those different areas that I already mentioned, and a voice for health and services research in Wales. I already mentioned that in the last slide, that how would we know what our priorities are for health services research in Wales? What are they? Is it possible to identify priorities? Are they competing priorities? What would we like Welsh Government research to fund more of, or less of, or differently? At the moment, I'm not really sure where that voice would come from. I think it would come from interested stakeholders and parties, but I think a network would help to formalise that a little bit more, and maybe make more heard some of the voices that are less heard. The next slide, please. So this is the last but one slide, I think. My predecessor, one of the predecessors in this role, was Paul Brocklehurst, Professor Paul Brocklehurst at Bangor University. And he undertook some work as specialty lead, which was commissioned by Welsh Government, which did a variety of things. It was a policy scoping piece of work, looked at some literature, evaluated and analysed that literature, and came up with a series of questions they felt, the team at Bangor felt, needed addressing for health services research in Wales to progress. And I've sort of inherited these key questions, which I'm very grateful for, and I think give a sense at least of some of the things that a network would then help to clarify and answer some of these questions, and add more questions, or even say some of these questions are no longer relevant. But it gives you an idea of some of the scope, and one of the wide scope of questions. One issue may be, are there some of these 6 questions that are more of a priority than others? I don't think they're listed in any order of descending or ascending priority. They're just there. There are things we've already talked about around impact, around joined up and evidence-based approach to delivering impactful research in Wales. What structures and oversight are required. So there is existing work that's been done by Paul and others around this. So it's not a standing start. It's actually, some progress has been made. And one of the things that Paul was going to do, and kind of I've picked up on, is this idea of let's try and generate some feedback on these, either through a network or some other forms of channel of communication. I'm trying to go for a network approach that can be consistent and sort of sustained over the 3 years that I'm in post, and then we can take stock and see if it carries on beyond that. So there's that work that's already been done. And, I would see ongoing communication in the short to medium term, focusing around some of these questions, but also encouraging others to come with their own key questions, especially maybe from outside of academia and the NHS as well. Next slide, please. Some of these risks and challenges I've already kind of alluded to, and kind of there's been a hint of that from others in the questions, which is great, because there are lots of structures within Wales, funded structures that overlap with health services research, and it would be crazy if we overlapped and duplicated any of those things. So it's adding to, what's the added value of health services research within and across these different groups, research groups in Wales and across the UK as well. And I think that's exactly what it is the health services research cross-cuts all of these. It's not exclusive to one or the other. It's actually a cross-cutting force. And that's one of the functions that a network could do, is to try and give a view of that cross-cutting nature of HSR and raise awareness that there is a discipline out there that does kind of bracket all of these things together and keep them alive. And it's possible to do research that isn't siloed. There is kind of broader and more joined up, if you like. As I said in the answer earlier, I think clear communication is really important about what the network would be and what it wouldn't be, clearing people's expectations, and being proportionate, I think, with information and events and activities. Absolutely having them on, but not having them on for the sake of putting things on. It's actually being really clear about what we do and why we would do it. And it is a challenge. The other challenge is the diversity of interests and topics and perspectives and paradigms within health services research. And that sometimes leads to more rocking of the boat than steering the boat. And I'd be very sort of conscious of that. I think rocking the boat is great to a certain extent until we all fall over and into the water, I guess. So it would be looking to steer some of that, and taking a view about some priorities and perspectives that need prioritising maybe within Wales. But yeah, I'd be more than happy to talk some more around that in the future. I think that's the next slide, please. So that's the end of me talking and presenting. Thank you very much for listening. I invite any further questions. I can see there are a few there that have been lodged. I see Martin has clarified his question about the distinctiveness of HSR in Wales, other than 29 specialties, policies, and just different. Yeah, the purchase of provider split in Wales affects delivery. It's absolutely there's a different, and I would probably say increasingly different landscape in Wales as opposed to England, Scotland, and Northern Ireland. There are a variety of differences that offers opportunities as well as challenges. Clearly, there are interesting projects that can be taken. We're doing one at the moment, which has been funded by the Royal College of Nursing, looking at nurse staffing levels, safe nurse staffing levels, given that there's law in Wales around staffing levels, but there's no law in England. There are only policy recommendations in England. So it's a natural experiment. So yeah, that difference between England and Wales can be a creative difference. It can also cause difficulties sometimes around planning research and planning research funding. I'm looking at Kylie Hart's feedback there. A network would be helpful to allow sharing of and conversation about what's going on. Okay. It may lead to a more cohesive and efficient way of enabling positive change. Yeah, absolutely. I mean, the scale of research is an important consideration, definitely. And the unfundedness, I guess, of research is something that we've all had to deal with at certain points. Certainly, scale and scaling up research is a key thing around capacity building and capability building in Wales. So I'd be very interested to hear more about that from Kylie and anybody else. And I agree that the sharing of information and conversations about that would be interesting to see. Yeah, especially around that, around the scaling up idea. I think obviously many very interesting and large-scale research projects start as small-scale and informal conversations. So, yeah, thank you for that, Kylie. Elizabeth asked, could a network take on a role for joint planning, coordination of research work programs? Yes, I think it could. Obviously, I mean, the devil is in the detail around that sort of planning and coordination function of a network. But that's exactly the sort of thing I think a network should be talking about. What would we do? Shared learning about things like joint planning and coordination. There's yeah, there are plenty of examples of researchers in Wales, as there is elsewhere, who are maybe unknowingly competing against each other, where if they work together, the quality of a research proposal, a funding bid, or the quality of their impact would be greatly enhanced by maybe more joint planning and coordination across Wales, across the sectors especially. I think there's a lot of untapped potential in terms of social care and third sector research in Wales, as there is elsewhere as well. So yes, I think the answer there. But again, it's sort of the detail of that, and it would be really good to talk about that further. And I can see one there from Julia. As it's an overarching cross-cutting specialty, maybe a network could focus on elements that affect all research and other specialties, e.g. methodology and leadership. Yes, that's definitely the sort of thing. It's what's common across all of those things. I think maybe HSR is the glue that keeps things together a little bit more. It's a common thread in many of those 30 or 29 other specialty therapeutic areas. Like I said, nearly all of them, if not all of them, have got health services research going on within them that isn't always labelled as that, or even designed as well as it could be because of that, if you like. So things like methodology, leadership, the Welsh context is definitely something that is overarching and cross-cutting, and something, again, like I said, I'd be very keen to learn more about in terms of how that might function within a network. What would a network do about that? How would we communicate that to others to avoid some of that duplication? Because I'm sure Prime, Wales Centre for Policy Research, they all do various aspects of that, but HSR could at least provide something that is distinctive and different and add value to that, I think. So, well, that brings us to the end of the questions in the chat bar, or whatever it is we call it. So I'm very grateful for everybody for tuning in. My email address is on that slide there, my Cardiff University email address. Where we go from here is that I'm going to take stock of the comments. Next steps would be to formulate some ideas for a network. If it seems to be there would be an audience for it, further test this in true improvement style, where we would run it as a series of small tests of change, maybe have an overarching theory of change. What is it that we would like to do? How would we know if it was working? Sort of flesh out some of those with input from others. I've already started talking to many people and colleagues, but largely those people who I already know or have contact with. So what I'm especially keen is to connect with people who I don't know, who may feel that HSR, health services research, they're not quite sure of a way in yet, but wish to be part of it. And I'm particularly calling on those people. But yeah, so I'll be in touch. We have your contact details, and I'll be in touch through Health and Care Research Wales to facilitate some form of communication, be it online. It will be for the foreseeable future, I guess, but where a bit more like a Zoom call, something where we can see each other and actually talk together and interact. And look at, as Helen from HSR UK has said there, around supporting and joining up with a Wales-specific network. Yeah, so what's already there? How can we capitalise on the excellent work being done by others, on the esteem of other groups like HSR UK and Prime, who have got internationally excellent research already occurring within their groups? So yeah, further discussions with that would be great, and I'll for sure keep that in mind. And just see some other questions coming in. Definitely good to join with healthcare research, well-funded research infrastructure. That's great. Yes, I think that's another thing a network can do is give people who may not know so much about that some greater exposure to what that means and how studies are come into Wales and how they're adopted and funded. I see in Angela's question, do you expect a growing number of studies? Has there been much HSR research happening during the pandemic? Or were studies mainly paused? Yeah, it was a bit of both. Many studies are paused and awaiting restarting. Of the 33 that are currently on the portfolio, at least I think about 20 were paused. But there are a large number of COVID-specific research going on in Wales at the moment. I think it's in the 40s, the number of COVID research, some of which isn't HSR. Clearly, it's kind of much more bench, laboratory focused research. But there's quite a lot of that there, of the work that is health services research, looking at kind of changes to workforce deployment, for example, changes to services, moving from online, from face-to-face to online using artificial intelligence, you name it. So do we expect a growing number of studies? Well, probably. I mean, it's always difficult. The issue is building out of those COVID studies and working on sustainability of those studies beyond the immediate, I think. So, and then getting those that have been paused back up running again, and yeah, planning ahead. Any scope for translation from policy to services, John, in that network? From Leslie, yes. Policy translation, knowledge translation, knowledge mobilization, whatever it is that we want to call it. For sure, there's already a lot of really good working going on across research and government in Wales and policy making in Wales. Needless to say, more could be done, and this could be facilitated through a network where we get a chance to speak to people in the flesh, as it were. So yeah, is there scope? Definitely. I think that would be an area and that is something that's already been discussed in the first few months since I took over the role, around what would that do. And the feedback there is that there would be a need, what a network would be needed for that, to have a coherent voice, rather than just my voice or the voice of those of us already who do have a voice. So yeah, I think that would be a really good outcome from that, and something to add to the list of functions within the network. Translation for sure, yes. Thank you, Leslie. So I think, yeah, like I said, I'll be in touch, and it'd be really good to talk to all of you again, and get some ideas and get sort of moving around what the next 12 months might look like. And if we weren't in the current times that we're in, then I'd be suggesting that we have some sort of a meetup in person. Clearly we can do that virtually, but ultimately that would be the thing, would be to have a peer-to-peer sort of network meeting where we can do some of these things in person as soon as possible, if we put it that way. So I can't see any more questions, so I think I'll call it a day there. Like I've said before, there's an email there. Please get in touch if there's anything there you were hoping I'd mention that I haven't. And diolch yn fawr am wrando. Thank you.